Now let's work on the flexibility and range of motion for our lower half of the body. I'm going to place my hands onto the chair. Let's separate our feet about hip bone distance apart and then step the left foot back. Let's try to have all 10 toes pointing as forward as you can, and then start to bend that front knee, the right knee, so it stacks atop the ankle and tracks towards the direction of the center of the toes. And I'm going to step my back foot a little bit further back, but find the distance between the feet that works best for you. You might even feel that your back heel is a little bit lifted. So mild sensation of a stretch. So I'm bending that front knee to stack and track. That'll be the maximum distance that the knee will bend. We don't want the knee to go past the ankle. You'll already feel a stretch along the back of that back leg. And then I'm just going to slowly straighten that front leg and a little lift of that back heel. And then rebend, making sure that front knee doesn't go past the ankle and tracks toward the center of the toes. And then straighten and lift. Rebend. And I'm watching my knee to make sure it's tracking towards the center of the toes. Straighten and lift. Let's do 2 more times. So we want to make sure that knee is in that proper alignment. That's for knee joint safety. And then last time, you'll feel a stretch on the front of that back leg as well. And then go ahead and rebend. We're going to keep this position. If you need to, if you'd like, you can walk your back foot a little bit forward, a few inches forward. We're going to keep the lower half of the body steady and stable. Nice stretch for that back leg. A little bit work for that front leg. And then we'll start with the upright position of the spine, shoulders over the hips. We're coming into a little twist here. So from here, we'll turn the head, the shoulders, and the chest a little bit to the right. This right arm can just dangle down, or you can keep the hand onto the hip and then come back to center. Let's do that 2 more times. Little twist just of the upper half of the body, lower half of the body stays nice and stable. And 1 more time. And then come back to center. Let's step that back foot forward and let's switch over to the other side. Right foot steps back. Remember, the distance between the feet is up to you. Try to have those feet about hip bone distance apart, all 10 toes pointing as forward as is comfortable. Start to bend that front knee. So left knee, the front knee is bending, stacking over the ankle, tracking towards the center of those toes, and really feel the weight into the heel. And then the back foot, maybe the heel is lifted a little bit or maybe not. So find what works best for you. You'll feel a stretch on that back front thigh and the back of the back leg. And then let's start to straighten the front leg, lift the back heel, and then go ahead and release it back down, making sure that front knee bends towards the direction of the center of the toes, or is pointing towards the direction of the center toes. Lift and rebend. So knee doesn't go past the ankle. We'll lift and release. You might hear the movement of my back foot. Lift and release. And 1 more time, we'll lift and then go ahead and release. Nice. Let's walk that back foot forward a little bit so you can settle the heel down. And then still maintaining that bend in that front knee. We're standing up tall. Let's come into that twist. We'll slowly, just the head, the shoulders, and the chest turn to the left. You can have the hand on the hip if you'd like, and then come back to center. So bottom half of the body stays nice, still, and stable. And then let's turn and come back. And one last time, we'll turn and then come back. And then slowly make your way back to right behind the chair. Let's go with keeping that right foot where it is. Step the left foot back. Now we're just going to step the left foot back, maybe a foot or plus or minus a few inches. Both legs will be relatively straight. The heels of the feet are about hip bone distance apart, and the back toes can angle just slightly out to the side. Keeping both legs straight, and let's turn on those thighs. And we're standing up tall. And then from here, with that strong flat back, we're hinging forward at the hips. Hands are on the chair for a little bit of support, just until you feel your mild sensation of a stretch. And then you can use some work with the hands to press your way up, but you'll also be using the strength of your strong flat back. So we're hinging forward just a little bit and then coming back up. We're hinging forward, maintain that strong flat back, maintain that strong core, and coming up. Let's do 2 more times. We'll hinge it forward, come back up. And then last time, hinge it forward and then come back up. Have a soft bend in that front leg so you can stand right behind the chair again. Let's move over to the other side. Step the right foot back, maybe about a foot, plus or minus a few inches. Heels of the feet about hip bone distance apart. Back toes, those right toes can angle just out a little bit. Both legs relatively straight. Turn on those thighs, and then we'll start engage through the core, hinge forward at the hips, just mild sensation, nothing more than that, and then rise back up. So these hinge forwards and then lift. So for me, it's not too deep of a hinge forward. I have some tightness in the backs of my legs. I've always had it. I think it's the way my body was built. And so it doesn't take a lot for me to feel that stretch. So this dynamic stretch, and then come back up. Nice soft bend in that front knee. Go ahead and step it forward. I'm going to turn to face you now, and I'm going to bring my chair. So I'm standing behind the chair facing you, coming into little side lunges. So go ahead and separate your feet wider than the hips. And once again, plus or minus a few inches, depending on how your body is feeling. So we're going to lunge side to stretch those inner legs, dynamic stretching of the inner legs, and also find the range of motion in the hip area. My toes are pointed out just slightly. To come into our side lunge, I'm going to bend both knees softly. I'm going to hinge forward at the hips, and I'm going to draw my bottom a little bit back behind me so I can make sure I'm maintaining that strong flat back and make sure my knees don't go past the toes. I'm going to shift a little bit to one side, bend one knee and straighten the opposite leg. When I bend this knee, it doesn't go past the toes, tracks towards the center of the toes. And then I'll come back up all the way to standing, and then move over to the other side. Soft bend in knees, hinge forward at the hips, draw my bottom back a little bit behind me, and then bend over to the opposite side. So knee doesn't go past the toes, tracks towards the center of the toes. Maintain that strong flat back as you come up, and we'll go over to the other side. So the depth of your side lunge is up to you. Thinking about maintaining that strong core, strong flat back, and you're drawing your bottom a little bit back behind you. So almost like a little bit back behind the heels. That's just making sure that the knee doesn't go past the toes. And then find a comfortable way of breathing. Let's do one more time on each side. So you're getting a stretch through the inner legs. You're also getting a stretch through the glutes and a little bit of work for those muscles as well. Nice, warming it up. Exercising it out. Let's come back to center. Start to step those feet together and then stand over to one side of your chair. I'm just going to slide my chair over. So let's find our range of motion for our hip joint. Remember, if you've had any surgeries or injuries, please modify or even skip. And I'll give you a few options. So we'll stand predominantly on one leg, hand on the chair the whole time. Let's lift the heel. So for here, you can start by almost like you're drawing a circle on the floor. And depending on the type of your surface of the floor, you might have to lift the foot up a little bit. If the hips feel good and it is safe and comfortable for you to go bigger, then you can go a little bit bigger, or you can even lift the foot completely off the floor and find your range of motion for your hip joint. But once again, do only what is safe and comfortable for your body. Nice. And you'll feel some work happening in this outer leg as well. Let's change the direction of our circles. So remember, if you need to keep those toes down and make small circles, that's fine too. So find what works best for your body. Maintaining and even increasing our range of motion and flexibility is a slow process. So you do need a lot of patience, and we never want to force anything. All right, that standing leg is getting some good work. So let's move over to the other side. I'm just going to slide my chair over. Stand up tall, good posture. Start maybe keeping the toes down onto the floor. If it is safe and okay and feels good to go bigger, then go ahead and increase the size of the circle Or if you want even more and it is safe for you to do so, then maybe you're lifting the foot completely off the floor and really feeling how the hip's doing. So sometimes we come into these movements, into the exercises, and kind of just do them without putting any mental effort into where we should be feeling. Let's change the direction of our circles. So really put your mind to your hip area so you can feel how the muscles are doing, how the joints doing, how everything's doing in there. And that way we can stay in a safe range of motion, safe movement pattern as well. All right. Okay, standing leg getting a lot of work, so let's go ahead and release down and shake it out.